Representative Paulsen from Minnesota, recognized for 5 minutes.
Thank you, Mr. Chairman, also for holding this hearing. I have two bills that I have introduced that I would like to touch on today that have bipartisan support and would benefit seniors on Medicare. The first is H.R. 5075, the Accelerating Innovation in Medicine Act, also known as the AIM Act, which I introduced with Representative Ron Kine. Currently, patients and providers are having trouble accessing the newest, most innovative medical technologies, and more barriers are coming from CMS rather than from the FDA. And we as a committee need to take a serious look at the CMS coding, coverage, and reimbursement process to examine how the agency is functioning, its impact on the biomedical ecosystem, and its effect on ensuring that patients will have access to the next generations of advanced therapies. Currently, the process of receiving a CMS code alone can take as long as 3 years. National coverage decisions are typically time-consuming and cumbersome, and some new therapies must go through a process of convincing each local carrier to provide coverage before a patient or a senior can get access. This process delays patient access to groundbreaking treatments. My bill, the AIM Act, would focus on the front end of this process by increasing patient access to new FDA-approved medical devices and procedures and speeding up the collection of data needed for Medicare coverage decisions. The AIM Act does this by allowing a manufacturer to place FDA-approved devices and treatments on a list where they are available for Medicare beneficiaries that self-pay. By agreeing to not seek Medicare reimbursement for 3 years, the devices then will be available without government red tape, paperwork, and administrative costs. And during that 3-year period, the manufacturer could collect patient data that will help streamline a future Medicare coverage decision. The current system is expensive, it's inefficient, and it gives providers, patients, and manufacturers uncertainty. And we need legislation like the AIM Act so that we can ensure the continued development of new treatments to improve Medicare outcomes, efficiencies, and lower costs. And then, Mr. Chairman, the second bill is H.R. 2404, the Treat and Reduce Obesity Act, that I've also introduced with Representative Ron Kine. Obesity is now an epidemic and a public health crisis that needs to be addressed. Over 40% of seniors are obese. This disease takes both a physical and an emotional toll on an individual and often is the cause of many other chronic conditions like diabetes, heart disease, stroke, and others. Nearly 20% of the increase in our healthcare spending over the last 2 decades was caused by obesity. And this disease directly costs Medicare more than $50 billion a year, and that number will continue to increase over the coming years. This is bad for our seniors, and it's bad for Medicare. Unfortunately, there are limitations in place preventing patients from accessing important treatments and providers that can help them combat obesity. The Treat and Reduce Obesity Act would remove these barriers by giving patients access to FDA-approved obesity drugs under Medicare Part D and allowing additional qualified healthcare practitioners to provide intensive behavioral therapy services. Patients and clinicians require access to the full range of proven, safe, and effective therapies for the treatment of obesity. We have the ability to save the healthcare system billions of dollars and, at the same time, make the lives of patients significantly better. And that's why this bill has nearly 150 bipartisan co-sponsors. We can't solve this problem overnight, but by taking action now, we will help us solve our obesity crisis over the long term. And finally, Mr. Chairman, I just want to touch on another issue that I'm working on. I recently held a roundtable in Minnesota with some hospitals, and they're concerned about the direction that Medicare is going in terms of too much regulation, too many requirements, and the reimbursement system being very unpredictable. Hospitals, providers, and patients all recognize that we need fundamental reforms to the system, otherwise the system will collapse and seniors will suffer. Thankfully, there are providers, health plans, and states out there that are now trying to find ways to make our healthcare system more efficient and effective. They're not trying to tie the healthcare system up in knots with duplicative process measures that may or not yield the best results, but they are focusing on outcomes, high-impact, clinically credible outcomes that we can focus providers around to achieve substantive and sustainable improvements for patients. And we can learn a lot from these state and local initiatives to strengthen Medicare. I look forward to working with you, Mr. Chairman, and my colleagues on those efforts to do just that. Those are just several of the ideas that I have for reforming Medicare, and I look forward to working with the Chairman in the future on these bipartisan ideas. I yield back.
Thank you, Mr. Paulsen.